So, hello everyone. Welcome to yet another episode of SPAG Fin's D-Log series Season 2. As we celebrate the World Heart Day, we are reminded of the importance of heart health in our daily lives. Today, in this webinar titled From Burnout to Breakdown, Why Heart Health Needs to be a Priority for the Younger Generation, we have our distinguished experts to throw light on how younger generations need to prioritize healthy behaviors to have healthy hearts. In today's world that is marked with erratic lifestyles, work pressure, stress, indisciplined eating habits, it is very important that we take a proactive approach of leading better, healthier lifestyles, especially the younger generation. If we see the data that seconds this situation, it is not very positive. The World Health Organization paints a rather grim picture. Cardiovascular diseases are now the leading cause of death globally, with a concerning rise of the incidence amongst the younger generation. Heart attacks among young adults have surged by nearly 25% over the last decade, signaling a health crisis that needs our attention now. This alarming trend is not just a statistic, but it represents the lives of our peers, our friends, our future leaders, making it imperative for all of us to take action and contribute in every little possible way that we can. The consequences of neglecting heart health are profound. Yet we see a huge gap in the way this topic is being addressed by young individuals. We still are spending long hours on our screens, whether it is our mobiles, our laptops. We eat a lot of junk food. We don't have a sleeping timing. But we are not considering how important it is to have a disciplined approach to taking care of our heart. And to tackle this very situation and to deliberate on several other aspects, we have, and I'm very honored that we have a distinguished panel of speakers from different arenas of healthcare to talk about this very, very critical issue. So without much further ado, let me introduce our distinguished panels who have taken out time for this discussion, and we are very thankful to all of you for doing that. First, we have Dr. Sameer Gupta with us, who is a renowned cardiologist, co-chair, Healthcare PhD Chamber of Commerce, and director of Cardiac Cath Lab Metro Group of Hospitals, New Delhi. Dr. Gupta is one of India's few interventional cardiologists certified by 5 American boards with expertise in internal medicine, cardiovascular diseases, interventional cardiology, and much more. Thank you, Dr. Gupta, for being here with us. We have Mr. Aliakbar Haveliwala with us, who is the Managing Director, India and Subcontinent at SmartCardia Medical Devices, with over 12 years of experience in cardiac rhythm management and cardiovascular care. Thank you, Ali, for being here with us today. We have Mr. Anuj Seth with us. He is the Managing Director at AliveCor India, and he comes with over 25 years of experience in technology and product development to transform cardiological care through deep learning and AI. Thank you, Anuj, and we look forward to great insights from you. We also have Dr. Shoeb Ahmad Khan with us. He's a nutritionist and nephrologist and one of the top 50 influential doctors on social media with a strong following of 478K influencers. Thank you, Dr. Khan, for finding out time. I know you are right now in the midst of sitting with your patients, but thank you so much for your time today. Again, a very warm welcome to all our speakers, and we look forward to some great insights and helping younger generations to take care of their heart in their most productive years. Before I delve and reach out to each one of you, I have an open question in which I would like all of you to reflect upon. We were just discussing before we actually started recording this session that more and more cases we are hearing about young adults falling prey to cardiac diseases, heart conditions, even heart attacks. I want to know from you, what is the main contributor to this situation? Why is this trend becoming more and more prominent? What is going wrong, or what is it that we are not doing right? So maybe we'll start with Dr. Samir, you who interacts with a lot of patients, and please reflect upon this. That why is this actually happening?
Yeah, Ritika, I think first of all, I think I want to congratulate you for raising this very important topic on the occasion of World Heart Day. Now, let me tell you a couple of statistics first, right? That 25%, 25% of all heart attacks in India happen before the age of 40.
Right.
50%, that's one in two heart attacks happen under the age of 50, right? So, and and the third thing is that Indians, when I say India, I mean Southeast Asia, India, Bangladesh, Pakistan, Sri Lanka, I mean, we're all cut from the same cloth. Um, we get heart disease almost 10 years earlier than our Western counterparts. So if you look at a Caucasian who's 50 years old, and you look at an Indian person who's 40 years old, or a Southeast Asian person,
Right.
the risk of getting heart disease, all things considered same, is about the same, irrespective of the 10-year biological difference, just by the
Okay.
fact they are of Southeast Asian descent. Okay? So heart disease is an actual epidemic, right? And it is the number one cause of death in India, right? 25% of people die of heart attacks. So, we have five of us on this channel, four of us on the speaker list, for example. So one of us is going to die of a heart attack. That's pretty much what the data shows. Now, there has definitely been an increase of what we are seeing in the incidence of heart disease. So this number of 25%, this is from a few years ago. Has this gone up to 26, 27, 30%? I don't know. Maybe we'll need more epidemiological data. And there are very many reasons. The question is, why is this happening? And there are many reasons why that we see this surge, right? When you look at the risk factor profile for heart disease, why does somebody get a heart attack? Right? It's not out of the blue. There are some risk factors. What are those risk factors? There's diabetes, right, which is high blood sugar levels, hyperlipidemia, which is high cholesterol levels, smoking. 20% of urban youth in India smoke, right? In the rural areas or in tier 2, tier 3 cities, if they're not smoking, they're having BD, they're having hookah, they're chewing tobacco, right? There is a family history of heart disease. So, today, unfortunately, the world we live in, all of us know somebody who's had a heart attack, heart disease. Somebody's got an angioplasty, somebody's got heart surgery. It's just the way it is. A lot of these factors are increasing over the last few years, with urbanization, with lack of physical activity, instant food being available on the press of a button. Previously, if you wanted to have an ice cream at midnight, you would just have to kill the urge, right? You'd like, I'm sorry, I can't have it. Now you just press a button and it gets delivered to you. A cake is delivered to you at midnight. So, all these lifestyle changes with urbanization that have happened have kind of precipitated the burden of heart disease in our entire continent, especially in India, is what I can say.
Agree. No, I think you've made some very interesting points, Dr. Samir, here, that it's a combined, it's a cumulative impact of what is happening in the ecosystem. We have the facility of ordering an ice cream, but we don't have the incentive of not ordering an ice cream to take care of our heart. So I think this is an important aspect. Yeah, Anuj, maybe I'll come to you. If you could reflect upon that, why are so many young individuals, and of course, I'm sure Dr. Samir has covered a lot, but why are the young individuals really facing this issue more and more?
Just to extend what Dr. Gupta just said, right? So a click of a button, you can order food. What does that mean? We're leading more and more of a sedentary lifestyle now, right? since COVID, remote work has become the norm, more or less. Yeah, we have exceptions with companies trying to get people back into the office, but more and more people continue to work from home. It's a desk job. You're just sitting at one place the whole day. So literally no physical activity whatsoever, right? Even if you had the urge of an ice cream earlier on, you would make the effort to step out of the house. Now you don't even need to do that. So, given all this and given the extended working hours that more and more people are putting in, I think the stress levels are also increasing. And this is all resulting in what we are reading more and more, that younger people nowadays seem to be falling prey to heart diseases as well. I think that's something to think about also.
Yeah. And it is unfortunate. We don't want this to be our dining table conversation, right? That, I mean, one of our colleagues, this thing happened, or our distant cousin, this thing happened. So, of course, that's not the kind of conversation we want. Dr. Shoeb, if I can get you here, or maybe Ali, if you could provide a perspective on this one.
Yeah, so exactly what Dr. Sameer and Anuj said, the lifestyle changes is really a challenge today for us. And we travel, we don't take care of, the food habits, and also for the sleeping habits. What I also feel, when you don't sleep well, that is another risk factor, which I understand that is leading to cardiac disease also. And also it leads to many other problems. But the one of the factor which I feel, it's sleep, which pattern which we sleep. That's one of the factor which I feel.
Agree. No, that's an important aspect, and that's more because of our habit of just gazing through our mobile phones, and the real culture. It's really unhealthy. Dr. Shoeb, if you are, if you could want to provide a perspective, that why more and more young people are succumbing to heart problems.
Madam, more and more people succumbing to heart. What I feel is the more common usage of social media. I think this thing was happening from before, all along. Before ThyroCare came and started testing thyroid, nobody had thyroid disease. So probably the more prevalence of social media things being recorded, I think it's more and more commonly reported. But this thing was happening right from the beginning. India is a place where pollution is significantly high, and it is very common in the urban areas rather than the rural areas. Again, that bias remains whether rural areas are reporting or not. But what I feel personally is that, as everyone already highlighted, the lifestyle, the 12 o'clock cake, and the Swiggy delivery guys, they're all pampering you, and they're preparing your grave and building their bank accounts. Probably, and the focus that everyone is having a very stressed out life. The amount of stress that we have, none of our ancestors had this stress. Everyone is on loan, everyone is living a
Yes.
limited life, everyone is first to first fight, EMI has to get paid. The stress is very high. Relationships have no value. So इंसान क्या है ना, क्या कहने को साथ अपनी एक दुनिया चलती है, फिर भी इस दिल में तन्हाई पलती है. So people are lonely, so they're bound to get heart attacks. Yeah. Thank you.
Great. So on that note, I think we've discussed the problems. I would now like to move to what we can do at our end to, address this. So, Dr. Sameer, I will bring you here in and, really talk about that how we need more and more young people need to take a proactive approach rather than a reactive approach to their health. Like we discussed, we all know about the problems, but still there is a gap between awareness and action. So what is that action that needs to be taken, that should be taken on priority today, and take a more proactive approach to health?
I think one of the most important things whenever you want to change anything, right? The crux of it comes from education, right? Education and awareness. And
Absolutely.
the reason for that is, prevention is better than cure, and the same thing goes with heart disease. Previously when my father is also a cardiologist, and I remember seeing his practice. Previously the child would bring the father, and now the father is bringing the child. When I say the child, I mean like 25, 30
Yes.
years.
Yes.
The father how did he have a heart attack? And one of the important things to understand that he was not aware that 25, 30, 35-year-old person never thought he could have a heart attack. One of the important reasons for that is he always had that misconception that nobody in my family has it. I do everything right. I'm eating what my father ate. How did I get it? Like hypertension is something that happens only in older people. So some of the things that we can do at a community level, at a policy, at a community level, is that we should get more awareness, get more education as to what are the risk factors. How does it happen? Why does it happen? And this has to start at a young age. Maybe a curriculum can be created in the school books. So the child can go and educate a young child can go educate the father. When they have those diagrams in 6th and 7th grade and 8th grade, where they teach you about the digestive system, the heart system, you can talk about what is a good heart, what is good health, how do you get it, what is physical activity. Something simple, Ritika, I see is I ask my patients, do you exercise?
Yes.
And they all say, yes, doc, I
Yes.
exercise. So then you start asking them, like, what do you do for your exercise? And they're like,
Yes.
oh, I
Yes.
go for a walk in the park. I'm like, okay, so how much distance do you cover? You're a 45-year-old guy, you're otherwise healthy, or you're 50 years old. How much distance do you cover? He's like, I walk about 2 kilometers in an hour, or
Yeah.
3 kilometers in an hour. And I'm like, that's for you, it's like tehelna. Hindi mein tehel ke aa gaya. You just go out cruising and you come back.
Yeah. Take a stroll.
It's not effective exercise. Yeah.
Yes.
So I
Yes.
think awareness is very, very important across platforms, social media, school, everywhere.
Yeah. And I think that's a great point, that awareness not only about, something that is directly linked, but even, this aspect of exercise, that how much exercise, at what intervals, what is the right time. And similarly, I will come to the other aspects of this, Dr. Shoeb, if extending to what, Dr. Sameer just talked about, when it comes to exercise, awareness about that, I think awareness around the whole nutrition aspect is also a very important, thing to consider here. So would you like to talk about that? Because we all know that 80% of the cardiovascular disease, including heart disease and stroke, is preventable. So taking the right kind of diet and focusing on our nutrition can really help us in having healthier hearts and preventing a lot of cardiovascular, issues. So what are your thoughts on this, Dr. Khan?
Yeah, definitely, madam. I feel that diet is the cornerstone. Let diet be thy medicine. That's what Hippocrates has told. And unfortunately, this generation, Gen Z and the millennials, has forgotten about diet. They think that the aim of life is to have a big meal, 6 course, 7 course. The bigger the star of the hotel, the more number of courses are there, and the more number of heart attacks to that sort of subset of population. So I think that system is wrong. Everyone should understand that diet is essential. We are not here to eat. We are here to contribute to the society. And eating is important, but not overeating. So probably the new generation has thought that eating is the aim. So I think that's wrong. First thing. Second thing, when it comes to exercise, without exercise, eating is more dangerous. And if you are exercising, the youth, which I see very frequently in my clinic, is those who take a lot of protein powders and then a lot of injections of steroids and creatine supplements, eventually leading to kidney damage. So protein is important. The whole protein thing is going on. Take a lot of protein, take a lot of protein, lot of protein. A lot of protein can be dangerous for the kidney also. And especially the keto diet. Keto diet, I think getting in keto diet, eating oily stuff, eating fatty stuff can be detrimental also. So probably the new generation is very looking at it as a very minute tip of the iceberg. The whole nutrition aspect is important, because the more healthier your heart, the more healthier all your organs are, including the kidneys, which I deal with. And I feel that the awareness on exercise is important as well as diet is important. Everyone knows this. That's the best part. Who knows that, the richest man in the world, Anant Ambani, he is not following diet and having an obesity, central obesity, such an irony. So probably dedication is important. Everyone knows what is diet. Everyone knows what is exercise, but no one has that commitment and dedication. So probably awareness towards commitment, dedication is the key. Yeah. Thank you.
Absolutely agree. And like Dr. Sameer said, I think education and the right information about nutrition is how much and what is important. Now I think, we've talked about this, and these are all great insights, but there is a huge opportunity that I see, and I think I will bring in Ali and Anuj here. Ali, with the rapid evolution of technology in cardiac care, how do you perceive the role of patient centric remote monitoring and highly personalized digital solutions? I think they play an important role in empowering the patient, also from a preventive point of view, the real time monitoring that you just mentioned. So I'm very keen to understand from you, because that's a huge opportunity for us when it comes to the integration of technology.
Yes, Ritika, technology has changed a lot since last 5 years. If you see after COVID, it has been drastically changing, and many of the things has come into the play. You see right from the watches to the patches and other devices, digital devices, which has come into the market. Patches as in plays a very important role in early screening and also in early detection of problems with the heart. So patches has an important role because you can wear the patch for 7 to 14 days, and you can do your all activities which is there in your regular basis. And patches records the data continuously with the ECG, and with multi-leads, patches really helps a lot. And with remote patient monitoring, it helps a lot where, even the clinicians can go to that cloud and see the data. And if there is any event which is recorded, that can be seen by the doctor, and the corrective actions which is required for the patients can be taken from the clinician. And also, having an added advantage is that the patient can travel across and also get the monitoring done. And including the generations we are talking about, young generation, it is easy to wear, and they can travel a lot, and they can do their regular activities. So patches has a different role in terms of digital monitoring and empowering the patients currently.
And totally, and I think in a way it has revolutionized the whole cardiac care ecosystem, right? And I see a lot of youth, like you just mentioned, wearing watches and patches. So, what is the difference? Who will actually benefit, from these, from the use of these watches or patches, and what is better, if I can understand?
So, watches has its own role, right? It can only monitor the heart rate. It cannot give you exactly what is happening with the heart rate changes. And when you do exercise, your heart rate definitely changes. But that heart rate doesn't signify there's any abnormalities which is caused into the ECG. Wearing a patch gives you a different ECG. ECG becomes a very important factor for the early screening and early diagnosis for the doctors. And patches are always beneficial for the patients because you have a continuous data of recording for long-term recording. And the studies and globally has suggested, even if you see the developed market like US, has one of the biggest advantage, like they do 6 million patients every year with the patches. So if we see the Indian population, I think which is, even not the tip of the iceberg. So
Yes.
there where, it plays a very important role completely to do it.
No, huge opportunity. And I think, Anuj, I will bring you here in. You are at the forefront of integrating AI into, cardiac care. And so I would like to understand from you that, how the adoption of advanced algorithms and machine learning is redefining our approach to heart health monitoring. What are the unique insights that AI provides, which traditional methods of data collection do not provide? What is the opportunity here?
Sure. So if you look at a traditional ECG that you would take in a hospital, right? Unlike, let's say, a blood pressure monitoring device, you know the range, you can do it at home. It's easy for most people to understand how to read a BP monitor, a reading out of it. Not the same with, let's say, an ECG, right? You've got a strip of paper with a waveform on it. Most people don't know how to interpret that. With AI, you're basically bringing that technology into the home now, right? So with devices, which now are very compact. You can carry around in your pocket. We've got a bunch of those ourselves. It's easy for people to just take an ECG at home. The AI and machine learning algorithms can analyze that, even let the patient or the user know if they have any sort of arrhythmias or if they're suffering from AFib or not. Yes, in terms of the treatment, you still will go to a physician. In fact, most of the times, even what you're doing at home will be under the guidance of a physician. AI is not supposed to replace doctors, right? That is never the intention. It's supposed to be an aid to help accelerate treatment if required and for early detection. That's the key role that it plays. And in a country like India, where if you go to remote parts of the country where maybe the internet is not available everywhere, maybe there's not a lot of good healthcare facilities available there, right? You can't have the villagers traveling to clinics for regular checkups. Devices like this, which are AI enabled, just makes things easier. They can be at their home or go to the local clinic, get an ECG taken with remote patient monitoring solutions, with teleconsultation solutions. You can actually consult with the doctor, with them still being in their village itself, right? So it just eases the entire thing for everyone, and that is the role that AI will play. But with every generation of AI, that is coming out, it's getting more and more sophisticated. In the last couple of years, LLMs, chat GPTs, and all the different technologies are taking even conversational AI to another level altogether. But if you take a step back to just traditional AI, right? Can we mine large volumes of data to understand if there are trends in that? You've got a patient who's taken ECGs over the last 5 years regularly, right? There could be a subtle change in an ECG over the last couple of months. You might miss it otherwise, but with AI, when you're going through that entire ECG history, AI can detect that, hey, there is a slight shift in the kind of recordings that are coming now. Maybe a consultation is required. So that is the kind of role AI can play here.
Which is a huge advantage, not only for that patient, but it also becomes the basis for several other, in the way it kind of informs the way other people are treated. So here I will really get Dr. Sameer, that what we just spoke about, the health tech, the monitoring, and the AI, how I would like to have your viewpoint as a provider, as a physician, that how that is improving diagnosis, treatment, especially risk prediction in cardiac diseases.
Yeah, I think the AI is definitely the new kid on the block, and it's a very exciting space. Now when you look at health, right, when you look at anything in medicine, or especially in cardiology right now, there are three things, right? One is prevention. One is that, can I prevent this event from happening? Second is diagnosis. If somebody comes to you with a problem, can I diagnose it effectively? And the third is treatment. That now I've diagnosed a problem, how do I treat this problem? So there are subtle improvements in technology that have happened over the last few years in each of these three spaces, right? So in prevention, genetics has started coming up. There are other kind of things which are coming up, but it's not made a significant headway yet. Because the question is, does it actually lead to, if I find out that I have a higher risk of heart disease, what can I do to prevent it? There are some lifestyle changes I can do from a genetic standpoint. The question is, can I predict that event? That, like Anuj said, is things which are possibly happening, and we may get more information about accurate risk prediction using some of these data sets in the future. I'm always amazed by the Apple Heart study, where if you go back and see, I think it was published in 2020 or 2021, where the number of patients that they studied, the number of people who were enrolled in the trial was 500,000 people. 500,000 people, or something ridiculous like that. It is crazy. This kind of information and data is not possible in other epidemiological studies, right? So that is from the preventive standpoint. In the diagnosis standpoint, AI can really help, like Anuj was saying, interpret those squiggly lines that I read every day called an ECG. So, help in that part of it. In the world of radiology, AI is taking a lot of shape. Even in the world of pathology, it's slowly and steadily coming right up. Even in the world of interventional cardiology, some of the imaging material we use, whether it's OCT and IVIS, where automatic image interpretation is coming up to help guide you and make you faster. In echoes, there are auto EF and other parameters which are coming up to help you become more efficient and accurate in your reading, or it gives you a good blueprint. Becomes your assistant. And then same thing is happening in the world of treatment as well, where there are some tools which are coming out which can help you, personalized medicine. Like if this medicine going to work better for this person compared to the other medicine. So these treatment algorithms and AI generation tools are also in the works. So it's an exciting space. I think there's definitely a lot of scope for it. It's going to help make the doctor make better decisions.
Better decisions,
For
yes.
the person.
Yes, and it is impacting the entire continuum of care, like you very rightly mentioned, from prevention to diagnosis to treatment. So there is a huge, opportunity here. I think here I would like to also bring Dr. Khan, because, of course, having a healthy heart, has its own advantages on the other aspects in the body also. There are recent researches that underscore that how maintaining a healthy heart lifestyle, it not only reduces, the risk of developing heart disease and stroke, but also cuts the risk of having a kidney disease. So, and that can have its own socioeconomic impact. So, Dr. Khan, you being a nephrologist, can you please throw light on that aspect? Because it's important to consider that, how it kind of reduces our the comorbidity issues as well if we are maintaining a healthy heart.
Yes, maintaining a healthy heart is like maintaining the engine of the car. So the healthier the engine, the better the car. And with specific to kidneys, kidney disease is a very expensive disease. It has no treatment once you end up with a CKD, and going on to dialysis or requiring transplant is very expensive thing. It has a lot of impact on the healthcare system. And as heart is concerned, the maximum blood which the heart delivers per gram of tissue is to the kidney. 20% of the cardiac output goes to the kidney. So kidney is a very, very important organ. It's a checkpoint. It maintains the environment of the body. So if you have a heart problem, suppose you get an MI, heart is not able to pump, and suddenly you get a kidney problem also. That's called cardiorenal syndrome type 1. Sometimes because of high blood pressure, uncontrolled blood pressure, heart becomes dilated and it is not able to pump properly, or it is not able to fill itself properly. Again, you get a kidney problem. That's called cardiorenal syndrome 2. And there can be something like cardiorenal syndrome type 5, where something like diabetes can cause heart problem as well as kidney problem. Diabetes can cause many organs involvement, but these two organs are very common. So heart and kidney is linked very closely. Sometimes kidney can also cause heart problem. Like if you get a kidney problem, that can cause pericarditis, uremic pericarditis. So we need to be very careful about it. So what I feel, if you maintain heart, it's enough that all other organs are also maintained. For heart maintenance, you would like to take low fat diet, which is important for kidney. For heart maintenance, you would like to exercise, which is important for kidney. Among the 8 golden rules to keep kidney healthy, the first is healthy diet. And healthy diet is important for heart also. Second is drink adequate amount of water. That's important for heart also. Third is avoiding use of unnecessary medications. That is important for heart also. And fourth is control of blood pressure. Fifth is blood sugar. And sixth is habits like smoking and, nowadays, cocaine and sniffing things. All those things these are all useful for kidney prevention, whereas these rules apply to your heart also. So probably maintaining a healthy heart is tantamount enough to maintain healthy all other organs.
Yeah. No, you very rightly said it is the engine of our body and we need to take care of it. Now, if we need to take care of it, we need a multi-stakeholder approach. So now what I'm coming to is, Dr. Samir, as we spoke, that you engage with a lot of policymakers as well. And we do know that if we need to have a harmonized cardiac care ecosystem, we do need some interventions at the policy level to, to enable the right kind of incentives, whether it is in terms of digital health, whether it is in terms of having access to the right treatments, promoting innovation. So what are your thoughts on that, and what is the kind of conversation that is happening in the policy ecosystem on prioritizing cardiac care?
So, Ritika, I'll tell you a wish list, right? Let me tell you a wish list of what
Yeah.
we would want, right? So, I think it's very important to understand that with the development of Ayushman Bharat, with the affordability of cardiac care for the people who
Right.
are below socioeconomic strata or who are in that strata has really improved. So a lot of these patients are now possibly getting angiographies and angioplasties and treatment for heart attacks and cardiac surgeries, which was probably not the case a few years ago. So I keep hearing stories of that. I treat some of these patients as well from tier 2, tier 3 cities, right? So
Mhm.
that in the future will improve the care in the periphery. The piece that is missing in this is the prevention piece, right? The
Absolutely.
prevention piece and regular health screening and health visits and all that entire piece is completely missing from this. And I think that it's important that that also get incorporated. I understand it will take time, right? I mean, we are a country of 1.3 billion people. It's not going to happen overnight. But in due course, that prevention and regular screening should come into the entire gamut of healthcare right now. Because the question is, when you look at healthcare, you have to understand, you know, now when you look at a car, for example, you take your car is making a sound, you take it to the mechanic and he repairs it and he gives it back to you, right? That was how it was done 20 years ago. Now they say you need a regular maintenance at 500 kilometers, 1,000 kilometers, 2,000 kilometers, whatever, right? At a certain number of kilometers. That's kind of predictive. Okay, we know that at 5,000 kilometers, we're going to start having this problem. So when this car comes to the showroom or to the workshop, we're going to check 1, 2, 3, 4, 5 things. We will not check the 10 things, but we will check 1, 2, 3, 4, 5 things because we predict that this is going to happen. So, kind of getting these predictive tools, um, using these health checkups is what would be ideal. And I think the other thing in the wish list is the awareness campaign. And this awareness campaign has to target the youths because that is they will, once they get educated, see, they are more pliable to changing their mind and learning new things. They will take that information, they will use it on themselves, and then they will also use that same information on their loved ones. So it kind of has to go both ways. So I think screening and national and awareness programs is something which is very important.
Absolutely, absolutely. I think that's great. And Ali and Anuj, from your aspect, from a health tech, what are the imperatives and interventions that you will like at the policy level, to enable the adoption of more and more, health technology into the cardiac care ecosystem?
Yeah. So, Ritika, we are bringing in this kind of digital health, at a very affordable cost, and where, we make this available for all the type of patients who can, go ahead and take this test. Like, for example, you get a test done for your blood test on a regular basis for the patients. And the same way, this test can be also in that range where, you can get a test done and you get a predictive value of your score in terms of AI, which is also incorporated into the digital health that is helping to predictive the score, the chances of
Right.
getting a AFib or chances of getting a heart failure or a heart attack, it will become more easier in the future. So this is helping a lot, and where patients would get this advantage over a period of time.
Great, great. No, that's a great intervention. And Anuj, anything that you are doing or you would want, any kind of support from the policy standpoint here?
I think the from a policy standpoint, like Dr. Sameer said, a lot of things with Ayushman Bharat is headed in the right direction. We're
Absolutely.
seeing not just at the policy level, but if you look at even from the core technology level, the kind of standards that are being defined around that to make sure different players come up with solutions that are all interoperable. I think that is all headed in the right direction to make sure maybe in the next 5 to 10 years, we'll have an ecosystem of devices that can coexist on the same platform, right?
Yes.
It's a huge thing to do that at a level at the population that we are at, right? But I think
Guys, yes.
the mind is in the right direction. I think it's just a matter of implementation and time that we'll see things like that coming in. Uh, from a company perspective, what we've seen being successful, especially being in the heart health space, look at it from a perspective of how simple is it to take an ECG, right? The traditional ECGs requires typically a separate room, especially for women, to be able to take ECGs, right? So it's time consuming. The actual ECG process by itself might be a few seconds to a minute or so, but the entire prep for that takes time, and it slows down the entire screenings and camps that are typically being done. But with the new age devices that are coming in, right? It's just devices like ours. You can see it in the virtual background that I have here as well. You just have to basically just hold it in your hand, and done in 10 seconds. Is as simple as that, and it just accelerates the whole process. We're not saying that these devices will replace traditional ECGs, but it's ideal from a screening standpoint. The moment you know there is an issue, if required, the doctor can say, hey, go get a 12-lead ECG done, right? The idea is to accelerate the entire point of care that needs to be provided, given the population that we have.
Yeah, yeah. So it is a Herculean task, but the fact is that the opportunity is huge. And like Dr. Sameer said, it needs to start with awareness and education. And each one of us needs to be involved in this initiative. So before we close, I would like each one of you to just give one quick call to action for our audience. I'm sure we have covered a lot, from exercise to nutrition to awareness, education, and technology. But one key takeaway, and any one of you can start. Ali, I can see you on screen. Yeah, please
Yeah.
start.
So, first of all, Ritika, I think sessions like what we're doing right now is towards awareness itself, right? So that is sessions like this, this generation is all about social media. So, this being made available eventually on social media is what with the current generation will consume as well. But in terms of the call to action, I think it's pretty simple, right? It's we've covered it during this conversation itself.
Yes.
Take charge of your health, right? Just taking small steps, consistent steps, which you're doing towards just prioritizing your health, and in the context of what we're talking, your heart health as well.
Yes, absolutely. Take charge. Yes. Dr. Sameer, what would you like to say?
I think it's important to remember that education is very important, and a heart attack or heart disease is not too far. So it's very, very important to get yourself checked, get your blood pressure checked. If you're in, most offices, those people who are watching this are probably young adults. Go get your blood pressure checked, get your annual checkup done, see if you have cholesterol, see if you have diabetes. And if you do have any of these things, please go ahead and take care of it. Don't let it go by the wayside. I see so many people every day who just completely disregarded the tests or disregarded their health, and now they land up in the soup. So I think that's very important.
Yes, that's true. I mean, we somehow live by the fact that I cannot be the one, which is not the right thing to do. We need to take charge, as Anuj said. Ali, coming to you, any one key takeaway for our audience?
Yeah, the key takeaway is exactly things covered over the call completely. We need to take care of the important steps, like taking care for diet, health, and also screening yourself on timely basis. Maybe it is like exactly getting an ECG done or getting a monitoring done, or at least going to the cardiologist. What I feel also is that, with this kind of events, it should be important that if you haven't had problems, you should not visit a GP. It is more important you should go ahead and directly see the cardiologist. So that is where I also feel that's one of the factor which is there in India. And they should see the specialist when you have that certain disease aligned to your problems. So that is the key takeaway from my side.
Absolutely. And Dr. Khan, anything, any key call to action from you?
Madam, call to action is कि दिल है कि मानता नहीं, and never settle. I think if you are going to relax, then if heart stops, that's the end of your life. You should keep it pumping, be energetic, be walking every day 10,000 steps, eat less, exercise more, work more, contribute to the society. Thank you.
Awesome. A great note to end this conversation. Just for now, it cannot just be this conversation. This dialogue needs to continue, and we all need to take charge. So I want to extend my heartfelt gratitude to all you speakers finding out time from your busy schedules, coming here and sharing your perspective with us. And like I said, it is just the beginning. This dialogue needs to continue, and these recommendations need to turn into action. And I will be in touch with all of you for different initiatives in different ways that we can do it. Let us, it is very important that we take these messages that are shared today actually to our heart and prioritize our health. It is not a luxury. It is not a one-off thing. It is a long-term aspect that we need to do. So thank you, all of you, for sharing these wonderful insights with us and for your time and interest.
Thank you, Ritika.
Thank you.
Thank you.
Thank you, madam.